Hi guys, I'm on my way to, where am I? Just going out into the field, so I don't need a seatbelt. So, I went to the doctor, and I said, it wasn't actually a doctor, it was some guy, I don't know what nationality he was, but one guy, young guy, and because I asked to, because I said I want to come off the medication, the Seroxat. You know, is there any? Every once in a while, what I do is I ask to see if I can come off the medication, this SSRI, the antidepressant, and you know I don't really get much help. There's nothing, unless you are rich, unless you've got loads of money where you can, don't know, sign yourself into some clinic or see some kind of therapist, and yeah, everything is paid for. But apart from that, forget it. On the NHS, there's absolutely nothing. So every once in a while, I ask, right? I ask the GP. The GP then refers me to somebody in the clinic. Sorry, in the medical clinic, in the place that I go to, in the doctor's surgery. I mean, so I make an appointment, see this guy. Already I'm kind of pissed off because this guy, he doesn't know what he's talking about. Well, he doesn't know what I'm talking about. So I said I'm trying to come off the medication, Seroxat, Paxil in the States it's called. And I've been on it for 30 years. Well, why do you want to come off it then? So I said, yeah, I've seen some reports, some studies that it can actually, it's a risk to dementia. And I don't want that. And obviously there are risks also with because I had to explain everything. I've got food intolerances, and that's because I take a PPI, a proton pump inhibitor, and because of acid reflux, and that allows, or potentially allows, opportunist or bad bacteria to migrate into the small intestine and then cause problems. You know, it's not the acid reflux medication, the PPI, reduces acid. You're supposed to have acid in the stomach. So if you have constantly low acid, then bacteria then can go into the small intestine and cause havoc. You start having autoimmune problems, autoimmune disease, because your gut is being destroyed, basically. It's being dismantled. So I said, I'm down to just a few foods that I can actually eat. And he said, what's this got to do with it? And I said, yeah, hang on. Paxil or Seroxat, in a recent study just a few years ago, has been shown to reduce, I think, les tone. So affect the les, or the LES. In English it's LOS, because they spell esophagus with an O instead of an E. But I'll just use the American terminology because I like that, the les, laws. I don't like laws, les. It sounds like a bloke, a person. So the les, or the lower esophageal sphincter, is the sphincter. Like when you eat, you have the gullet, the esophagus, and then you have the opening of the stomach. This is called the les. It's a sphincter. It's just like the anal sphincter. It's like that. It opens and closes. Like if you've got a problem in your anal sphincter and it's lax, then you're gonna have problems, aren't you? That's terrible. But not as bad as if you have a problem with your les here, in your esophagus. So this will allow then acid to creep up, and then you can get esophageal cancer. You can get esophagitis, which is inflammation, and so I have to take the PPI in order to stop that. But the PPI, the proton pump inhibitor, or the, how do you call it, the acid reflux medication, can predispose you to gastric cancer. So, and also predispose you to dementia and to kidney problems, kidney disease, and fractures, because you're not digesting the all the vitamins and minerals and stuff. When it comes to gastric cancer, your body is trying to compensate and produce gastrin, which it keeps trying to produce it, and you can have a serious problem. So I said the Paxil, the SSRI, relaxes this les. So I'm getting back to the point. So the antidepressant relaxes this les, the lower esophageal sphincter. That's what the studies show, and give rise to reflux. Because then I thought about it. I thought, oh wow, so yeah, it makes sense, because things that chill you out, like apparently weed, or at least chamomile, is what's it called? It's a relaxant. So it relaxes you, and it chills you out, and it relaxes that area as well. The les, it relaxes it. So you don't want that. If you have to take antidepressants and you're in a state of a chill state, which I'm not, because I don't take that much, then it will relax that area as well. It's just like chocolate. Chocolate increases serotonin, which the drug does as well, or affects serotonin positively. So, you feel happier or calmer. But also chocolate relaxes this les, so you have more reflux. So chocolate causes reflux. Chamomile is a relaxant. It's good for the body, for the stomach, but it's not good if you've got acid reflux. So in some people, in my case, it causes reflux. So if I've got a stomach ache, I'm going to have to suffer with reflux if I take the chamomile. So it does one good thing, and then, it is not so good. Ginger, for example, is good. It's really warming. If you've got a stomach ache, it's really good. But ginger helps your body produce more acid in the stomach, which sounds bad. But then what the ginger does is it helps with motility. So how do I explain this? It has an effect of making the food or liquid or whatever go through your stomach faster. So there's less chance for the food to reflux. Some people who have, so there are a few sphincters. One sphincter, your esophagus to your stomach. This is the les, okay? And so imagine this is the stomach here. You have this les here. The stomach is here. It goes around like this, and there's this bit here called the pyloric valve. That's a tiny valval sphincter. If this one is too tight, then you can have more reflux. So they have, what was it? I'm not sure what the drugs are called. Prokinetic drugs or whatever. A drug that focuses on this, but ginger actually focuses on this and relaxes this sphincter. So if you eat ginger, then you have less reflux, because the motility, the speed at which food goes through the stomach is faster, and so there's less chance of reflux, right? Anyway, so I was explaining this to him. He's fucked. He's totally fucked. And he was putting his hand on his head and saying, and looking at his paperwork, and he said, so would you like talking therapy? I said, well, whatever you have to offer, is there any clinic or anything that can help me come off the medication? I've been on the medication for 30 odd years, 33 years. Is there anything? Well, there's CBT, cognitive behavioral therapy. Do you know anything about that? I said, as a matter of fact, yes, I do know. I think it was Albert Adler. He was the one of the proponents or one of the founders. So I explained to him, yes, I know what the model is. He said, I see. He's probably thinking, yeah, oh, fuck me, I've got a live one here. Because most people don't know shit. They don't know anything. It's not their fault. So they feel higher than you, right? So I probably knew about the cognitive behavioral therapy before he was born. So anyway, he said, "Oh, this is what we have to offer. Just try it. Just try it." I said, "Oh, okay, all right, then I'll try it." And he said, "Expect maybe a phone call or a text, and they'll contact you. Everything is done by fucking text now, and because of my eyes, I have to keep looking at the text. It's just, bloody hell. Text, or it's on the computer. On the computer, I suppose it's okay because you can put it far away. Well, anyway, this lady contacted me, and she's a Pakistani or Indian, like Asian, right? Well, not Asian because there's different Asians, but she's like Pakistani or Indian lady, and she's like English, born here. You can tell that they're born here, but they still have that accent, which is all right. It's okay. The most annoying thing about this woman, this young woman, was she was speaking to me, and then afterwards, almost after every sentence, she was saying, "Is that all right?" So she would go on about something like when you have thoughts, that's okay. She's talking about something. You have thoughts, and these certain thoughts intrude. How do you feel? Couldn't take it. I couldn't take it. At the end of every sentence, does that make sense? It's like I'm talking to a fucking. I mean, I'm not demented. I'm not a fucking 5-year-old. I do know the English language. Like, it's horrible when you meet someone like that and they like talk down to you as if you're a child. Does that make sense? Is that all right with you? And it was so bloody annoying. So, like, it kind of had the feeling like she doesn't give a shit. She doesn't give a shit. She's reading off some script. Or, yeah, she knows her stuff, okay? But I'm thinking, what kind of help could this woman give me? Maybe she should, like, see someone that she can help. She can't help me. I don't know how is cognitive behavioral therapy going to help me when I'm trying to come off medication? Because I said to her, I'm okay now. I can reason, and if thoughts come, then sometimes I can deal with them. Sometimes I can't. But when I come off medication, even though I have the tools, it's not gonna be. I'm not gonna have the capacity, the brain power to be able to deal with my thoughts. I know what I have to do, but I can't do it. I'll get angry. I'll start crying. I'll smash things. I'll be sad. How are you going to control that with CBT? And she said, "Oh well, just try it. Maybe you can." Well, that's in a sense, in a way, it's useless, but also, yeah, you never know, I suppose. So anyway. It's like these guys don't give a fuck. They don't care. They do not care. I'll tell you why. I said I've got ADHD. I said I'll try and remember the appointment. And I've got problems with my eyes. She sent me like a booklet, and I thought I can't read this stuff. It's so fucking long. I'm bored. I don't want to read this like booklet. It's a big A4. I'm happy she sent it to me, but it's like she doesn't fucking listen. I've got ADHD. I don't like filling in forms. She sends me forms. So I said, I might forget some appointments. Well, we'll remind you. So they reminded me, but I don't want to look at the bloody phone all the time. My eyes are hurting. So I want to kind of not look at the phone and kind of have a fasting, like go into hibernation and not look at the phone anymore for 6 months or whatever to heal my eyes if it's possible and my brain and my neck. So she sends me a text, I think, the other day, and then another one, I think, yesterday. I thought, oh, okay. But I'm not sure if I've got an ADHD assessment test. They're going to phone me. And that's another one. And I'll tell you about that in a second. And then I've got this one here. So today she rang. It was about 3 o'clock. And I thought, oh no, I wonder if that's because I get lots of phone calls, and then this bloody computer thing saying you have forgotten your bloody scam, or like in Pakistan somewhere, sir. You know it's a scam, and you put the phone down. So I'm just fed up picking up the phone, and then it's a scam and this and that. So yeah, today I picked up the phone. You know, sir, you have this. Quickly put it down. Yeah, another one the other day. Sir, how are you doing? Yeah, put it down. I don't give. I know you don't give a fuck about how I'm doing. I'm brutal now. I just put it down, and I don't want to do that. You see, so it causes me stress having to put the phone down because I'm not going to talk. But sir, no fucking but sir. I'm going to put the fucking phone down. But so what is it? Yeah. So she rang, and I can guarantee you she rang once, right? And I didn't pick up the phone. I wasn't there. I can hear it from the other room, and I ran, and you can't phone these people back. And then that's it. I bet you that's the only fucking chance I'm gonna get, knowing that I've got ADHD and I can miss appointments, right? That's the only chance I'm going to get. These cunts don't care. They absolutely don't care. They're just ticking the boxes and they're doing their work. Oh, the person, you know. To be honest, I'm not bothered about it because I couldn't stand her voice. I couldn't stand her. I just couldn't stand the way she ended the sentences. It's like you're a fucking 2-year-old or a dementia patient of 150, like talking down at you. You know, the thing is, like, what pisses me off is I probably know more about this stuff than she does, and she's talking down to me. It's not my ego, I'll tell you. Yeah, it is. Everyone has an ego, fair enough, but just her voice is, that's not ego. Her voice is just so fucking horrible. Oof. Imagine marrying someone like that, having to listen to that. And that's when she's in a good mood, being nice. So basically, at the end of every sentence, almost, Mr. Fury, is that all right? Yeah, it's all right. Yeah, that's kind of. I tell you, I wouldn't be able to do a face-to-face interview with her or appointment because every time she says, "Does that sound right?" I'll be saying, "Yeah, it sounds right," and you can see the fucking grimace in my face. Yeah, so horrible. So if I get struck off with that CBT therapy that's going to save me, then so be it. Rubbish therapy anyway. Rubbish therapy. Well, not a rubbish therapist, that's for sure. There's no. Are there any white people in this country anymore? The last therapist that I saw was from Afghanistan or from. No, not Afghanistan or Bangladesh. Like, I remember talking to him, right? This was like when after my dad passed away. It took about 6 months to get this guy, and then oh yeah, like when they say I'm a counselor, that's it. All bets are off. There's various types of counselors, right? And to be honest, I don't want counseling. I want a proper therapist. Like sit down on the fucking couch and do some analytical work. Hypnotherapy, and anything like that. Talking about I can talk about my past till the cows come home, but I think you need a bit of both. Like that an analytical kind of, not Freudian, that kind of therapy is like the yin, and you need the yang. You need to take action. Whereas CBT, cognitive behavioral therapy or behavioral therapy, tries to address the behavior. Oh, you're getting angry, or try and see what thoughts become behind that, are behind that. Address these thoughts. Are they real? Is it true? So you try to reason with your own thoughts, which is really good. That's the action, the yin, the yang. But you need the yin as well. You need to know, why do you feel like this? And part of the yin, no, the yang is also it's chemical. But all these all these therapies are all split up. They should be all together. You should, have the psychiatrist, the cognitive behavioral therapy or something similar, and the more kind of deeper kind of analytical therapy or hypnosis. You should have it all together, because you're not just this analytical part. You're a whole human being, so like when someone has cancer, you have the oncologist, you have the like you have the oncology department or whatever, but you have the surgeon that deals with cancer. You have the person that deals with chemotherapy. You have the other people that deal with radiation. I know they're not good examples because some people don't want to go down that route, but tackling a problem from various angles, because the reason why you have what the hell is this? The reason why you have this disease is stems from the fact that you're a human being. You're not just one. Cognitive behavioral therapy isn't going to bloody deal with a deep depression or anxiety or ADHD. I don't think so. So you need other things to back it up. You need a more holistic kind of, that's what I'm trying to say. Because I think that diseases are holistic, and so you have to deal with them holistically. Anyway, so with the ADHD is another thing. They keep sending me texts, and they say, "Don't miss this appointment." It's got in capital letters. If you miss this appointment, you can be like terminated. Like the Terminator's gonna come. You're terminated, motherfucker. So I clicked on the link to see when my appointment is. They've got a date. I think it's the 24th, the same day, or is it tomorrow? In a few days' time, I don't know. Today or no, has it gone? But they don't say if it's a telephone call or a video link. There's no link. They say they're just going to contact me. Where? Like from the sky? Some alien is going to come down. I can't go to their office. Their office is in where is it? Somewhere near London. Yeah. So I'm just waiting for the text. So I assume they're going to send me the final text, and in that final text, it will have a link that will send me to some kind of, I don't know, some kind of video platform. So I can have a video consultation with them. I filled in so many bloody forms, and when you've got ADHD, you don't want to bloody fill in forms. So, and they send me forms, of course, right? I've filled in every form. Like, what do they want to know? Like, I've ticked all the right boxes, So they should know that I've got ADHD, judging by my answers. But they want an interview, and then after all this, I'm thinking, what the fuck am I going to get out of this? They're going to say, "Oh, yes, you have ADHD." I know they're going to say that. They're not going to say no. And so what benefit do I get? What's in it for me? All this bollocks. What's in it for me? Can you help me? What they're going to say is, well, these are the drugs, Ritalin or whatever, you can take. I don't want to fucking take any drugs. And this is a therapy maybe you can do. Cognitive behavioral therapy. Then I'll be punching my own face saying, what the fuck did I stress myself out for? I'm going around in circles here, And I tell you, if I had the money, I can get myself sorted out. But it's the old problem, isn't it? You only have money when your brain is okay. You can work, you can do business, you can do the shares or whatever. You can make loads of money. You've got the money, right? You've got the money. You've got this. But that's when you don't need it. It's when you don't have this, you don't make money. You don't have funds, so you can't reach out to these professionals, these private people to help you. So that's the situation I'm in. I need help. But this NHS help is absolute garbage. It's absolute rubbish. No wonder people have got so many people are walking around in the street and doing bad stuff because you know you got someone with schizophrenia supposed to take their medicine, but they are in control of taking their medicine. Like, that's stupid, isn't it? Like, if you are in control of taking your medicine, but you're not quite there, it's a it's a disaster waiting to happen. I don't know what I'm talking about. Well, I do, but I've got no answer. The only answer is once I sell the house, it will free up some funds, and then I can see a functional medicine doctor. They're so bloody expensive. I paid for one like three, was it 3 years ago? 3 or 4 years ago? Just the appointment, right? Over the video call. Just one appointment for an hour was 550 quid. I thought, bloody hell. And I had another appointment with us. So you get a package. It was £3,500. That's without the supplements and without other therapies that they advised me to do. Like there's one thing called the Gupta program. There's another thing which is a further £1,000 or £500 or something that you don't have to do, but they say to calm your mind, your central nervous system. So I was fucked after paying 300. I thought I'll pay 3,500 and then that's it. So you pay for 2 consultations with a doctor. It's an actual GP that is trained in functional medicine or whatever. Then you have to pay for various blood tests, blood, urine, hair sample. They're really good tests. They're quite in depth. Better than any NHS like blood test or urine test that I've had. It shows quite a lot that's going on in your body, and then you pay for also you get 6 sessions with a dietitian, and I didn't even finish with the dietitian. I said, oh, okay, forget about it. She was very friendly, but only had 3 sessions with her, and I thought, yeah, I know what I'm doing when it comes to food. I bloody know what I'm doing, which I probably don't. Thing is, I think I have more knowledge than the dietitian. The doctor, no, but maybe not the doctor, but the dietitian, yeah. So for me, it's a kind of learning. I could get the functional medicine like certificate. It costs a bit of money, but first you have to have like some kind of degree or certificate in nutrition, or be a doctor or be some kind of therapist in order to go for that. So I was thinking, yeah, I might do that actually, just for myself. Well, anyway, yeah. So that's what you do. Well, that's what I'm gonna do. Once I have some money, then it's probably not going to be 3,500. It'll be about at least 4,000, 4,500, maybe 4,000. To get all those tests, to see what's happening in your body, and yeah, I suppose it depends what you present with to the initial consultation. But before you've got a history. You write down a history, like many, like I did about 9 pages, my whole medical history and stuff. But yeah, I think it's a good thing, every once in a while, every few years, if you can afford it. But I only could afford it then. I had some money, and then now I might go for it again, just to see what's happening in my body, because the tests are really extensive. They're really good. So there's a saying like in functional medicine: don't guess, test. Don't think, oh, I've got a pain. Just test to see what's going on. And as I said, the tests are really, really deep. Um, you know, Much deeper than the stuff that you get in the NHS. Just to give you an example, like I was worried about my kidney function, and so I collapsed while I was doing the carnivore. I don't know what I did wrong. Loads of stress, blood pressure through the roof. This was a few years ago when I first arrived at this house. And so they said you should see a kidney specialist or your doctor. So I went to the doctors and I said, and they made an appointment to see the nurse. So the nurse said, "Oh, bring a the urine sample, whatever." I said, "Oh, okay, all right." So I brought my urine sample. Then I went to see her, and she gave me the results. But the thing is, they checked just about three things or four things: creatinine, I think creatinine, EGFR, bun, just three things. And but meanwhile, because I had to wait a few weeks, I got this test on Amazon. It's these strip tests, and you pee and you do you check your urine. This test showed about like 30 different things. It cost 29 quid, 30 quid, but it showed creatinine. It didn't show bun. It showed like a lot of things. It showed your glucose. What else? It showed quite a lot of information. And when I brought it with me and I showed her, I said, "I've been testing it with this. What do you think of this?" And she said, "Oh wow, that's more than that shows a lot more information than we have." And she was laughing. I thought, "Fuck me, fuck me." It's like there's an old joke once, like a really dirty joke. Like I don't know. I was told this when I was a kid. I remember, like the bloke goes to. I can't say this if there's children or teenagers. Bloody hell. Okay, I'll do it like a cleaned up version, right? A very clean version. So a bloke goes to the hospital to get treated for something, and like you've got this old nurse like with a fag coming out of a fat whatever coming out of a fag coming out of her mouth. "Come on, hurry up!" And then throws the man out, slaps him, throws the man out after he's been seen like he'd broken his leg or his arm or whatever. And then the man sees the next door, and you have a beautiful like I don't know maid maid uniform, nice stockings and everything, beautiful woman, hi, massaging the man, and he comes out with a hard on. He comes out, and so the man says, "What's that?" And he goes, "Oh yeah, that's Booper. The first one was NHS." All right, it's a stupid joke, but it just reminds me of that. Like, you get like quality service if you pay for it, like Booper, this private, and you get like the bare minimum if it's NHS. It makes sense. But I remember when I was living in China, I just went privately because it's so cheap, and you get seen to, like in you can be seen that day or the next day. You just go to the hospital, say, "Oh, I've got this problem." And I remember I had a spot here, and it was growing, and I was really worried about it. And like, if it was here in the UK, right, you'd have to go to your GP, then you have to make an appointment to see a skin specialist, right, dermatologist. And then they'd have to book you in to see what's wrong, take a biopsy if they need it. That would take fucking months and months and months. Unless, for example, if you go to the doctors and the spot is really black, oozing with blood, then it sounds really dangerous. But if they're not sure, it will take ages. Fucking ages. So, in China, I had this spot here, and it was like for years, it was growing, and it was like wobbly. I didn't like it. And so I went to see that, like, directly. Be quiet. Be quiet. Shh. No howling. So, that was Dave. So, what was that? What's wrong with it? David? Oh! Oh, oh. Gotta start them off. Okay, sorry, Timmy, sorry. So I went to see this dermatologist directly in the hospital, and he said, "Oh yeah, I see what it is. Do you want to take it out?" I said, "Yeah, yeah, take it out." Like the next day, they put like something blue on my face, like some napkin or whatever, and they cut it in the middle, and they put some acupuncture things on my legs so I wouldn't feel the pain. It slightly hurt. No, how do you call it? No anesthesia, nothing. They cut. They said it will hurt a little bit, and I said, okay, okay. And I think the point in the foot or the leg controls this facial area or the nerves. It hurt, but not that much. They took it out, and they said they sewed it up, and they said, um, you'll get the result in a few days' time. See what if it's benign or if it's anything bad. He said it seems okay. So after the third day, I got the result. They said everything's okay, Mr. Fury. That's it. Here, you'd be bloody suffering for a year. No, I mean, if they took the thing out, you'd have to wait maybe a week, 2 weeks before they tell you if it's benign or if it's bad. So that's what you get for private and NHS. If you don't have to go to the doctor, then you never think about it. But when you have contact with the doctor, and some people are going to say, I had contact with the NHS and they're superb. Yeah, they are really good. The nurses are really nice. They try and help you. And once you're in there, then it's okay. But it's difficult to get in there sometimes. And nowadays with immigration, I feel it's more and more difficult for the NHS to be able to handle. Um, as I said, I haven't been to the dentist for years because the dentists don't take any NHS anymore. They're full. So since I've been here 6 years, I haven't been able to get onto an NHS dentist list of patients. They're all full. So I had to have it private. I had to go privately to Norwich. And still, when I went there, I'm wondering where are all the English people? There was one Asian guy or Pakistani guy, and then he finished. He took my bloody teeth out and caused a problem. Then the next woman came. She's from Bulgaria. Like, where are the English people? Don't they do these jobs anymore? It's weird, isn't it? You can understand in England, but this is Norwich. In Norwich, like, where, where have they gone? They hibernated. They've gone into all those little villages. Yeah. So, yeah, that's what's happened today with the. I'm not sure. It could have been the. It could have been the ADHD assessment. After all this time, they ring me and I miss it. And these people won't give you a second chance. That's how much they care. They say, well, if you can't, their vibe or other people here, if you can't make the appointment, it's down to you. It's like disrespect. There's people waiting, maybe more needy than you. If you can't even make the appointment, look at fucking ADHD, you idiot. Well, not you, but the people, the clinicians, those people should know. If the person has ADHD and they miss an appointment, then what? Like, you're stuck in a really difficult place because they can't treat you differently to other patients. But shouldn't they? Like, if a man comes with one leg and he's on crutches, should the person, like the doctor, say, can you please hurry up, we've got other patients here? Like, shouldn't he take note of his disability? But they don't. When it comes to these disabilities, they don't. Well, I don't really think that I'm missing much, The is that alright? Does it make sense? That one, forget about her. The ADHD appointment, even if they say I have ADHD, I may benefit if I go for the PIP, but PIP is a benefit. So, like, if they might want to, oh, you need an assessment for the if you to have ADHD. Yeah, I fucking missed the appointment. Yeah, there's your assessment. There's your proof. I keep missing appointments. Why didn't you write it down? Even if I fucking have it stuck in my forehead, I'll forget it. Okay, all right, guys. So yeah, that's my talk today about the appointment that I missed. I'm never gonna get a call back. That's it. They go on to another person. It's just like in that period, you know, after my dad passed away, I think it was, that I asked for help. I got this guy from Afghanistan. He was talking, or I don't know, from Bangladesh, I think. And I thought that's why I don't like counseling, because therapy should be non-directive. You know, non-directive therapy. So if you say, I don't like these bastards, and like the therapist will say, yeah, you're right, those bastards are real. You're not supposed to direct the person anywhere or agree with them or egg them on. You're supposed to say, that's interesting. How does that make you feel? You know. So, like, the therapist is like a sounding board, like a wall where you bounce off ideas. Not you have an idea and it becomes absorbed, and or it's bounced back to you with an addition. More ideas. People. An agreement. They agree with you, and then you go off. The person has to be like almost silent. Well, it depends what kind of therapy. Is that all right? Does it make sense? I felt like saying, no, it doesn't make sense. Your voice is like pissing me off. Look, another private number. I know it's going to be, sir. No, I'm not going to answer it. I'm going to decline it. No, I'm not. Well, anyway. So, yeah, this guy from Afghan or Bangladesh, I was saying, because I was talking about women, I was saying, so fed up with these women. I was fed up about women and stuff because of divorce and stuff. And he was agreeing with me. You said, yeah, in our country, the women don't act like that. If they do, they get beaten. And I thought, this is a fucking therapist. This is a therapist. Like, how's he going to fix me? He's not supposed to fucking agree with me or make even worse statements. I ticked that one off. I crossed that one off. I thought, fuck off. Another one. Another one. Yeah, another one. Yeah. So, yeah. In that period of time, I actually did meet one white person. They exist. One woman in her 50s. And she, what did she? They had a kind of, in mind, have a buddy scheme. So someone who's going through the same problems as you meet up with them. And I thought, oh, I'm going to meet a lady. The first time I met a woman in 17 years. So I met with her in a cafe. And immediately the fucking first thing, like, I didn't like it. So I met her and I was going to make I was going to order a tea. I said, would you like a tea or something? I'll go and get one. She said, no, it's okay. So she sat down and I sat down. Then afterwards she got up. She said, I'm just going to go and get a tea. Okay. So maybe she didn't want the tea initially. So she went and got a pot of tea and one cup for herself. And I looked down, I thought, fucking cheapskate. Fucking hell. I offered her a tea. Right, I was going to get a tea for myself and for her, just to be nice. She said no. Then she got a tea for herself and she didn't offer me anything. So immediately my alarm bell in my brain said, okay, get the fuck out of it. Let me get out. I wanted to get out, but I had to do the therapy. It wasn't any therapy. It's like some buddy scheme, where you talk to someone who's gone through the same things as you. And they're kind of trained slightly. By us, she's not trained at all. So, what happened? So, they set me up with this woman, and this 50-year-old woman, blonde woman. She was about 5'1". I remember she told me, because how am I gonna know who she is when I go there to the cafe? The first time I've been in, it's a Waitrose cafe. It was quite nice. So she's supposed to be a person that, like, the person that they set you up with is someone that has experienced the same thing as you. So, like, I told them I've had depression all my life for maybe 40 years. I've been on medication for 33 years. And so they set me up with someone with the same, so she understands me. So in the appointment, I said, so, like, we understand each other. We're like, there's some common ground. We have something in common. So I said, um, yeah, it's really horrible being on medication and having depression. I said, how long have you had the depression for? And how long have you been on medication? Oh, she said, I only had depression maybe for about 5 months. And I said, how long were you on medication for? She said, only a few months. I thought, fucking hell. And you are supposed to help me. How the hell do you know what it's like to be on medication for 30 years and have depression and anxiety, ADHD for 40 years or more? Like, they set you up with people that, it's like, when I was sitting there, I thought she was like some kind of therapist, or she would know something. She's just a normal person who's had depression for a few months in her life and was on medication for maybe 2 months.